The NHS will be bankrupt unless victims of negligence are paid less in compensation.
Health service leaders have written to the Justice Secretary calling for the payments to be cut.
Now, according to this letter, the NHS in England spent £1.7 billion on clinical negligence claims just last year. Niall Dickson, Chief Executive of the NHS Confederation, joins us now from our London studio and is among those calling for a cap. Thank you very much for joining us this morning on the programme. Tell us why you're calling for a cap.
Well, the reality from the Prime Minister downwards is that everyone accepts the health service is under enormous pressure. That means our members are making decisions on a daily basis about what they can provide and what they can't. And we've got to a situation where clinical negligence claims have become really neither fair nor affordable. As you said, 1.7 billion last year. The pipeline of claims, the things that are coming forward towards the health service, is £65 billion. And perhaps even more serious than these huge numbers, it is rising. In the last 5 years, it has risen 11.5% every year, year after year. Now, that is simply unsustainable. We can't go on like that. We need to find a fairer system, a better way of calculating and a better way of legally managing this issue.
OK, I'll tell you a couple of things that spring to mind, and please do respond to them. The first is, why are there so many claims? What is going wrong in the NHS that people feel, and it's a big step to take, that they need to make a claim? The second is that if there is a cap, then certain solicitors will say it's not worth my while taking on these cases. So innocent people who have been wronged won't have the protection to say, hold on, you need to fix this.
Well, you're right. Obviously, it has to be a balance between what society can afford and obviously recognising that people who've been harmed should be compensated. Now, the issue of why more people are claiming, I actually think that part of it is the health service has got a more open culture, which is absolutely right, and is more transparent about when things go wrong. And that makes, in a way, people are told more about what has gone wrong, and therefore they may be more likely to make claims. I think the health service does have to understand what drives people to make claims, and I'm sure there are improvements that we can make in the way that we handle and support families through that process. There's certainly a lot of smaller claims are also coming through now, so I think there may well be a cultural thing at work here as well, which encourages people to make claims. So I think, again, that's a complex issue. It is not because healthcare that doctors are practicing less safely, though there is a problem. The more claims there are, the more health professionals are frightened of being sued, and the more likely it is that we go backwards and we go to a closed culture. Now, on your second point about lawyers and so forth, we need to, again, it's a question of finding a balance. But at the moment, for example, there are claims where more money goes to the lawyer than to the claimant, and that can't be right either. There are cases where the claimants and their lawyers take the health service to the door of the court and then realise the health service really is going to defend this, and then they disappear and say, OK, we won't, and the health service is still left with the costs. We just need to find a fair way which absolutely does compensate people, but recognises we have a free national health service. So in a way, we shouldn't really be compensating with private care for people who should be able to access free health care in their support going forward, but that they do get fair compensation.
There has been a government response, Ministry of Justice, saying that to help ensure this happens, fair compensation, it set out proposals for a fairer way, setting the personal injury discount rate, as well as asking the Civil Justice Council to look at measures to control costs in clinical negligence cases. On a practical level, how will this work, time-wise, in terms of the cap and the amount?
Well, as you know, politicians at the moment, trying to get them to focus on anything other than Brexit is extremely difficult. There is an opportunity with something called the Civil Liability Bill that the government could put some of this stuff into that. It won't be the major reform, but they could reverse this change to the discount rate, which is a self-inflicted wound by the government a couple of years ago by a previous Lord Chancellor, which is adding, in their estimates, an extra £1.2 billion in claims against the public sector. So I think there are limited things they can do now, but we would also like a more fundamental reform, although we accept that, of course, trying to get legislation at the moment is extremely difficult.
Niall Dickson, Chief Executive of the NHS Confederation, thank you very much for talking to us and explaining